Hello and welcome to this podcast brought to you by the Isle of Man Anti-Cancer Association. My name's Sandy and I'm the Executive Officer of the Association and a cancer survivor.
And my name is Malcolm, Chairman of the Isle of Man Anti-Cancer Association and a former surgeon. The Association has posted a series of podcasts on this site with a cancer awareness theme, aimed at providing listeners with information about the signs and symptoms of specific cancers to encourage early presentation as a way of enhancing survival. We've asked that, in those who recognise that they may have such symptoms and signs, to visit their GP or practice nurse at an early stage and discuss any concerns they may have.
In this series of podcasts, we want to look at the journey that those presenting to their family doctor or practice nurse may set out on. In this podcast, we want to talk specifically about what patients might expect regarding their initial appointment in primary care and any subsequent onward hospital referral to the appropriate specialist.
When you see your family doctor or practice nurse, your signs and symptoms may already have gone away. Things may have got completely resolved and nothing further is required. The healthcare professional seeing you may also be able to reassure you that you have a simple, non-cancerous condition that may either resolve itself or require some relatively simple treatment in the form of medication or minor surgery. They may wish to see you again in a couple of weeks to ensure that all remains well. If your symptoms subsequently return, then you should go back and see your doctor again. Symptoms associated with many diseases, particularly in the early stages of that condition, can be intermittent.
Symptoms associated with early cancer can often seem fairly trivial. Patients may feel embarrassed troubling their doctor, particularly when they see others in the waiting room with more obvious medical conditions. But an important role that GPs undertake is to be the first point of contact for patients who might have a non-urgent medical condition. They are the primary care service within the NHS for patients with new symptoms who will refer on to secondary care services when they identify the need. Any health professional is as happy reassuring patients all is well if they feel nothing is amiss as they are when handling a patient who warrants onward management. If the healthcare professional feels that you might have cancer, they will refer you on to a specialist.
Hospital waiting lists, whether for outpatient appointments or for surgical procedures, are not new to the NHS. In recent times, due to a number of factors, they appear to have got longer. We know that cancer is a disease that waits for no one. It is continually progressing, albeit often very slowly, and early treatment is important in the overall outcome.
Waiting can be a very worrying time for individuals and those around them. It can impact on people in a variety of ways in their daily lives, affecting them in their workplace or home life. The majority of individuals who find a new lump or develop some new symptoms, such as a cough or unexpectedly noticing some blood somewhere, and are concerned about it, will ultimately turn out not to have cancer. For example, less than 1 in 10 new breast lumps are cancerous. Rapidly ruling out cancer or removing the uncertainty about what is going on is extremely important to those having to wait for the answer.
A couple of decades ago, guidelines were introduced around target times for managing patients suspected of having cancer. Over the years, hospitals were set targets requiring a stipulated percentage of patients to have passed certain milestones in their cancer journey within a specified time period. With 10 such different milestones in place in recent times, the whole process had become somewhat unwieldy, particularly with fairly rigid timing of clinics and the array of investigations that some patients require.
Manx Care, in line with similar changes in the UK, have recently simplified things down to 2 particular milestones, whilst retaining the original endpoint of start of treatment. The main milestone is that 75% of people should have a diagnosis within 4 weeks, with treatment beginning within 62 days of a referral. There is a reassurance milestone of 31 days from decision to treat to the first treatment.
To many, this may still seem quite a long time. Remember, though, that quite a number of patients, particularly those who do not have cancer, may receive their benign diagnosis at their first visit. Patients presenting with a breast lump often have cancer ruled out following a clinical examination carried out by a specialist, with a subsequent mammogram and ultrasound undertaken during the same visit and the result conveyed to them before leaving this one-stop clinic. At the other end of the scale of things, some cancers can be difficult to diagnose, particularly small tumours in difficult places to access.
Every health professional working in the field of cancer would like patients referred to them to have a quick answer to the question that really matters to patients at this stage: do I have cancer? However, it is also vitally important for the clinician to be absolutely certain about the answer before imparting that message to the patient. In some cases, this can take some time to achieve.
This first step, the initial visit to your GP, is often the most daunting, and many will be tempted to put it off, hoping that things will simply go away. However, it is important to remember that cancer that is diagnosed and treated early results in a better outcome. Leave it up to your GP or practice nurse to determine the answer to the question, might I have cancer? After all, they will have encountered your situation many times previously, whilst this is likely to be the first time for you, and they may have more experience and training around how best to manage your symptoms. If you are concerned that you might have cancer, pick up the phone and make that appointment.
More details can be found on the official Isle of Man Government website under Statutory Boards. Then go to Manx Care with the downloadable document entitled Your Urgent Suspected Cancer Referral. In the next podcast in this series, we will talk about the investigations you may undergo. Thank you for listening.